For some more insight, let's bring in Dr. Chen. He's Assistant Professor of Public Health at Yale University. Welcome to the program, Doctor.
Thanks for having me.
Of course. So the World Health Organization estimates 54 million people in China suffer from depression. A further 41 million people suffer from anxiety disorders. To what extent is this a part of the national conversation?
Yeah, I think this is, according to non-clinical surveys, it's around on average around 16% of the Chinese population. But I think we need to emphasize nationally the different age groups, different populations. Like for older age cohort and for the middle-aged people, they suffer more from mental disorders of some kind. And also women have a higher depression or mental illness rate than men. And also especially for the group of new moms who just give birth, but who, especially during this pandemic, they do not have their family members following them and taking care of them. So that will easily cause postpartum depression. And the pandemic globally also caused two another very important groups. Previously have lower rate, but they have now very fast increasing rate. One group is children and adolescents. We know that they have been homeschooling, they have a brain development fast growing, so their cognitive skills, non-cognitive skills are all suffered because they only connect with people through Zoom, through online class. Seniors, because for seniors, they have an economic security issue, and also the isolation as a result of avoiding infection also drives up the depression rate, and also the Alzheimer. All those kind of diseases are related to isolation, including the mental illness.
Yeah, I want to pick up on one of these groups that you've just mentioned, because you talked about middle-aged groups and even the young. I just was reading a research this month, found that Chinese college graduates are facing significant mental health challenges from the pressures of school, career progression. And it almost runs counter to a common belief that success and possible wealth equate to better well-being.
Yeah, exactly. So economic is one issue, but for the college graduate students, they may not worry about the day-to-day life, but they have their job stress, especially finding a job during the pandemic is very much a challenge. And also there's a large social inequality. The economic and social inequality also drives up people's stress and makes people more depressive. And also some other socioeconomic factors may take effect. For example, the environmental. Our study at Yale find that during polluted days, during winters, people feel more with bad mood. So those are the situation facing young adults. They have more stress and they become a higher risk group. And there's also a stigma associated with this kind of disease.
Right.
People don't want to talk to friends about this disease. And so that's why in our data, in our research, we show that people sometimes wait until retirement to cure this disease. But that's too late. So we can see a surge after retirement when people seek care, no matter it's outpatient or inpatient.
Dr. Chen, we have about 30 seconds left. Very quickly, what kind of resources are available to those suffering mental health challenges?
Yeah, I think most importantly, we need a strong support from family and to signal and to screening those high risk, and also health education screening for mental health issues should be allocated more to the primary care facilities and family doctors. And the last resort will be the mental illness therapy, but that's too costly. Some other socioeconomic policies may have, for example, a better salary for older adults, for example, increasing social pension will also have. I think more targeted, and some the hotlines for the suicide, for depression will also help. And eventually, I think it would be more important to emphasize the resources at the prevention stage than the treatment stage.